Good morning, students. Today we are going to discuss about the chapter Chemical Coordination and Integration, which is the chapter 21, and it is the last chapter which is coming in P3 exam, upcoming exam. I'm not saying the last chapter for term 2, so don't be confused. So this is the last chapter. We are doing revision for the P3 exam. So before starting this chapter, I want to say something about chemical coordination and integration. You can understand from this term chemical coordination. That means some chemical substance which coordinate our each and every organ or cell communicate, like the nervous system. So in this chemical substance, so by the help of, not as in the nervous system, we have seen by the help of the nerves we can connect with the brain and we can react according to the consequences. It is like also the same thing, but here the stimulus, or you can say the coordinating supervisor, is different. That is a chemical which is proteinaceous in nature. So I'm going to talk about the hormones. Now we have to know that in our body we have two type of glands, that is exocrine gland, which secrete enzymes and which help to catalyze any kind of metabolic reaction in the cells of the body. But the most specific part of these things, that this gland have duct. So through the duct, enzyme will secrete from the exocrine gland. Through that duct, it will goes to the cell and catalyze the reaction, and after that it will revert back, because it will not destroy during any kind of reaction. Now if I am coming to the endocrine system gland, the other kind of gland, that is totally ductless gland. Now whatever the secretion will be created in this gland, it will be absorbed directly to the blood, and it will act to a specific organ but far away from their origin site. I think I'm clear here. Now, endocrine system. It includes endocrine glands and their secretions, which are called hormones. So what is the nature of hormone? Hormones are non-nutrient. They don't give us any nutrition to body development or anything. They are basically chemicals which act as intercellular messenger so that one can create some kind of activities and it produce in very trace amount. Now, how many endocrine glands are present in human body? Hypothalamus, pituitary, pineal, thyroid, parathyroid, thymus, adrenal, pancreas, gonads. Now I'm coming to the first endocrine gland, hypothalamus. You can see the picture, that is red circle, and you can understand easily it is present basically in the brain. So neurosecretory cells, that means nuclei, of the hypothalamus secrete which type of hormone? Number one, releasing hormones. Number two, inhibiting hormones. Number three, oxytocin and vasopressin. These are three categories of hormones. Now, what are the releasing hormones? These hormones basically stimulate secretion of pituitary hormones. I'm explaining you. From hypothalamus, one chemical or hormone will be released and then it will stimulate pituitary to secrete another hormone so that it will go to another organ and stimulate to release other hormone, like hypothalamus release gonadotropic releasing hormone, and this gonadotropic releasing hormone will stimulate pituitary so that it will create the sex corticoid hormones, and then it will stimulate testosterone to secrete it will stimulate testes to secrete testosterone or stimulate ovary to secrete estrogen and progesterone. Now, these are the releasing hormone. That means these are one another stimulating to release different kind of hormone. That's why they are categorized in the releasing hormone. But in the inhibiting hormone, when too much hormones are excreted, then what will happen? It may cause adverse effect. So then hormone will create or a signal pituitary to stop the secretion of the same hormone. This is called also negative feedback, that I am now secreting too much, and if you are secreting me too much, now I am going to be so much fat. So please stop now, like this. So this is negative feedback, or you can say inhibiting hormones. Now oxytocin and vasopressin, these are basically transported axonally and stored in pituitary. So now we are coming to the second endocrine gland, that is pituitary. You can see in the diagram, pituitary is located in the bony cavity called sella turcica. It is attached to hypothalamus by a stalk that is known as infundibulum. Now, what are the different parts of the pituitary? Adrenohypophysis, that is the anterior pituitary. Neurohypophysis, that is the posterior pituitary. Adenohypophysis or anterior pituitary have two more subparts, pars distalis and pars intermedia. So first of all, obviously we are going to talk about the first subtype of the first anterior part of the pituitary, pars distalis. It produces following hormones. What are these hormones? Somatotropin or growth hormone, prolactin, thyroid stimulating hormone, adenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone. Now, if I'm going to talk about the somatotropin or growth hormone, it basically helps for the body growth. But if it will secrete in the oversecretion, it will causes gigantism, or it will secrete in a below the normal level, it will cause dwarfism. Now, oversecretion of GH means growth hormone in adult, mainly in the middle age, sometimes causes acromegaly. Megaly, that is another kind of disease which creates severe disfigurement, especially of face. It leads to serious complications and premature death. Early diagnosis of this disease is difficult. It may be undetected for many years. Now, the second hormone which are released from pars distalis of the anterior pituitary, that is prolactin, which regulates growth of mammary glands and milk production. Third hormone, thyroid stimulating hormone, which stimulates thyroid gland so that thyroid gland can secrete T3, T4, which are basically thyroid hormone. Now, the fourth one is adrenocorticotropic hormone, stimulate the synthesis and secretion of steroid hormones like glucocorticoid from the adrenal cortex. Follicle stimulating hormone stimulates gonadal activity in male. FSH and androgen regulate sperm formation, which is known as spermatogenesis. In female, FSH stimulates the growth and development of ovarian follicles. Now, the last hormone which is released by the first part of the anterior pituitary is luteinizing hormone. It also stimulates gonadal activity. In males, it stimulates the synthesis and secretion of androgen from testes. In female, it induces ovulation and maintains the corpus luteum. Now, we are going to talk about the second part of the anterior pituitary, that is pars intermedia. In human, it is almost merged with pars distalis, that is the last part of the pituitary. So it produces melanocyte stimulating hormone. Basically, this hormone act on the melanocyte so that it will create melanin, which is the pigment, brown pigment, uh, and create the skin pigmentation. So now this is all about the anterior pituitary. Now we are going to talk about the neurohypophysis or posterior pituitary. So it secretes basically two kind of hormone. oxytocin and vasopressin. So, oxytocin contracts the smooth muscle. In female, it stimulates contraction of uterus at the time of the childbirth and milk ejection from the mammary gland. Now, the vasopressin or antidiuretic hormone, the last hormone which is released by the neurohypophysis of the pituitary gland, that is vasopressin. So it stimulates reabsorption of water and electrolyte by distal convoluted tubule of kidney to the blood, and thereby loss of water through urine, which is known as diuresis. Now, if deficiency of ADH will happen, it results in diminished ability of the kidney to conserve water, leading to water loss and dehydration. This is called diabetes insipidus. Now, the third endocrine gland, pineal gland, smallest endocrine gland located on the dorsal side of the forebrain. It secretes melatonin. Function of melatonin regulates diurnal 24-hour rhythm of body. Example, sleep wake cycle, body temperature, etc. Influence metabolism, pigmentation, and menstrual cycle. Influences our defense capability. Number 4, endocrine gland, thyroid gland. That is the largest endocrine gland. It includes two lobes located on the either side of the trachea. Please see the diagram on the left side so you can uh, get average idea of the location of the trachea. So the lobes are trachea. In the lobes of thyroid gland are interconnected with isthmus, which is a connective tissue. Thyroid gland is composed of follicles and stromal tissue. Follicular cells secrete the following hormones: thyroxine, which is known as tetraiodothyronine T4, and triiodothyronine, that is T3. Second hormone, thyrocalcitonin. Now, what is the thyroid? Means tetraiodothyronine and triiodothyronine function: regulate of basal metabolic rate, physical, mental, and sexual development, support RBC formation, control metabolism of carbohydrate, protein, and fat, maintain water and electrolyte balance. Thyrocalcitonin function: it is a protein hormone. It regulates the blood calcium level. Iodine is essential for normal hormone synthesis in thyroid. Now, if the thyroid will secrete in a high level, that is known as hypothyroidism. Enlargement of thyroid gland, deficiency of iodine. In adult women, it causes irregular of menstrual cycle. Hypothyroidism during pregnancy affects the baby, causing stunted growth, cretinism, mental retardation, low intelligence quotient, abnormal skin, deaf mutism, etc. If the thyroid hormone increase in in heavy amount or over amount, what are the adverse effect of the psychological activities? That is, that is, you can see in the picture, that is ab- development of nodules or cancer of thyroid gland, exophthalmic goiter, which is known as Grave disease. It is a form of hyperthyroidism. Symptoms: enlargement of thyroid gland, protrusion of eyeball, increased BMR, and weight loss. Now, the fifth endocrine gland is parathyroid gland. These are four glands which are present on the backside of the thyroid gland. You can see the red four dots on the backside of the trachea in the thyroid gland. So these are one pair each of the two lobes of thyroid gland, and they secrete parathyroid hormone, which is a peptide hormone. So what are the functions? Increase calcium level in blood, which is known as hypercalciamic hormones. Stimulates the bone reabsorption, that is demineralization. Stimulates the reabsorption of calcium by renal tubule and increases calcium absorption from the digested food. Along with TCT, it helps in calcium balance in the body. Now, the thymus gland, a bilobed gland located between lungs, behind the sternum, on the ventral side of the aorta, and it secretes thymosin, which is also a peptide hormone. What is the function of thymosin? Differentiation of T lymphocyte, which provides cell mediated immunity, promote antibody production for humoral and immunity. Now, the thymus basically degenerated in old individuals, so production of thymosin decreases. So as a result, immune system of old persons become weak. Now, the adrenal gland, that is also another endocrine gland. It has two parts: adrenal cortex, that is the outer part; adrenal medulla, that is the inner part. Now, adrenal cortex, that this has three layers: inner zona reticularis, middle zona fasciculata, outer zona glomerulosa. It produces corticoid hormones such as glucocorticoids, mainly cortisol; mineralocorticoids, mainly aldosterone; androgenic corticoid. Now, what is the function of glucocorticoid? Involved in carbohydrate metabolism, stimulate gluconeogenesis, that means production of glucose from any kind of non carbohydrate source like protein or fat. Lipolysis, that means breakdown of fat; and proteolysis, that means breakdown of protein and create the glucose. Inhibit cellular uptake and utilization of amino acid. Maintain cardiovascular system and kidney function. Cortisol stimulate RBC production, produces anti-inflammatory reaction and suppress immune response. Now, mineralocorticoid, which is the other hormone released by adrenal cortex, regulates the water, that is body fluid volume, so that electrolytic balance can be occur, osmotic pressure and blood pressure. Aldosterone stimulates the reabsorption of sodium and water from renal tubule and excretion of potassium and phosphate ion. Now, the Adrenal, third hormone of adrenal cortex, adrenogenic corticoid, which helps for growth of axial hair, pubic hair, facial hair during puberty. Now, what are the different deficiency of corticoid hormone affects carbohydrate metabolism? It causes acute weakness and fatigue. So this condition is called addition disease. Now, adrenal have the second part, that is adrenal medulla, which produce catecholamine hormone such as adrenaline, epinephrine, noradrenaline, norepinephrine. They are rapidly secreted in response to stress emergency situation, so called emergency hormones, hormones of flight or fight. They increase alertness, pupillary dilation, pillow erection, that means rising of hairs, or you can say goosebump, then sweating, heartbeat, heart contraction, and respiratory rate. They also stimulate breakdown of glycogen to increase glucose in blood, also stimulate the breakdown of lipids and protein. Now the another kind of endocrine gland is pancreas, which is a composite gland that is exocrine also and endocrine also. Now, if we think about the endocrine gland, then pancreas have some islets of Langerhans cell. So these are about 1 to 2 million islets and alpha cell and beta cell in the islet of Langerhans tissue secrete peptide hormone. Alpha cell will secrete glucagon, beta cell will secrete insulin, and they maintain glucose homeostasis in blood. Now, glucagon, hyperglycemic factor, it acts on hepatocyte, that means liver cell, and stimulates glycogenolysis, resulting in an increased blood sugar, that is hyperglycemia. Stimulates gluconeogenesis, reduces the cellular glucose level, uptake and utilization. Now, insulin, it acts on hepatocyte and adipocyte and enhance cellular glucose uptake, cellular glucose uptake and utilization. So, blood glucose rapidly move to hepatocyte and adipocyte, thus blood glucose level decreases. That is called hypoglycemia. Stimulate glycogenesis. Now, what is diabetes mellitus? It is the disorder due to prolonged hyperglycemia. Symptom: loss of glucose through urine and formation of harmful compound like ketone bodies. Treatment of insulin therapy. Gonad, these are two type. Testis, that is male gonad, ovary, that is female gonad. Testis, it is the male primary sex organ and an endocrine gland. A pair of testes is present in the scrotal sac. It is formed of seminiferous tubules and interstitial tissue. Leydig cells in the intertubular space produces hormone called androgen, mainly testosterone. So what are the function of androgen? Regulate the development, maturation and function of the accessory sex organ, spermatogenesis, sperm production, stimulate sexual behavior, that is libido, growth of muscle, hair aggressiveness, low pitch voice, etc. Help in anabolism of protein and carbohydrate. Ovary, it is the female primary sex organ. A pair of ovaries is located in the abdomen. It produces one ovum during each menstrual cycle. Ovary is formed of ovarian follicles and stromal tissues. Ovarian follicle produces estrogen, which is a steroid hormone. After ovulation, ruptured follicle forms a structure called corpus luteum, which secretes progesterone. It is a steroid hormone. Now, function of estrogen that stimulates growth and activities of female secondary sex organ, development of ovarian follicle, female secondary sex characters and sexual behavior, development of mammary gland. Function of progesterone, it supports pregnancy. It acts on mammary gland to stimulate formation of alveoli, that is sac to store milk and milk secretion. Now hormones of heart, kidney and gastrointestinal tract. Arterial wall of heart. It produces a peptide hormone which is known as arterial natriuretic factor ANF. When blood pressure increases, ANF causes the dilation of blood vessels to reduce the blood pressure. Now, JG of kidney, juxtaglomerular apparatus, it produces erythropoietin, that is a peptide hormone. It stimulates erythropoiesis, which is formation of RBC. Gastrointestinal tract, it produces some peptide hormone, example gastrin, which stimulate gastric gland to secrete HCl and pepsinogen. Secretin stimulate exocrine pancreas to secrete water and bicarbonate ion. Gastric inhibitory peptide inhibit gastric secretion. Cholecyto, cholecystokinin stimulates secretion of bile from gallbladder and pancreatic enzyme from pancreas. Now, several other non-endocrine tissue secrete hormone called growth factor. These are essential for normal growth of tissue and their repairing and regeneration. Now, if I'm going to see the summary of what are the different types of hormone, you can see peptide, polypeptide, protein hormone. These are insulin, glucagon, pituitary hormone, hypothalamic hormone. These are in the category of peptide, polypeptide, protein hormone. If you see the steroid, cortisol, testosterone, estradiol, progesterone. If you see the iothyronine, only one, thyroid hormone. Amino acid derivatives, that is adrenaline or noradrenaline. So I think I have make you understand. Still, if you have any doubt, just ask me freely. I will again explain you. Thank you.